hope you found this useful, this process of starting a conversation, having conversations, understanding what it means for people to have cancer in terms of it being a long-term condition, having consequences of both the illness and the treatment, all the different things people might need support with along the way, especially illustrated through the case studies that we've just used with you, and a real sense of how we need to come together to work together. So as part of the Tower Hamlets Living with Cancer program, we have spoken to a lot of patients and carers, but we have also spoken to an awful lot of service providers and organizations as part of our asset mapping. And when we've been having those conversations, our intention has been to understand what services currently exist, how they work together, how they share information, what does the team around a patient potentially look like, what kind of support do carers get, and what kind of support do both patients and carers need. But more critically for us in Tower Hamlets, we learnt that there's an awful lot of services dotted around in many different shapes and sizes and guises across the different sectors, from the hospital to communities to the voluntary sector, the local authority, in borough, out of borough, amazing levels of support for some of our patients, but how we work together is perhaps not so clear and not so systematic. The other thing we learned as we went through this process was we talk about people living with and beyond cancer, people living for another 10 years, but at the moment a lot of our holistic support that we talk about is really targeted a lot of the times at people who've been diagnosed and going through treatment. We are not necessarily thinking about and finding the patients who had cancer 2 years ago, 3 years ago, who are at home living with the consequences of their treatment and their diagnosis. And some people do a great job and they get their treatment, they're all sorted, they've had all the support they needed, and they've gone back to work, they've had great family support all around them, great team, great clinical team, great community teams, and it's been fantastic. And for many, it's an enormous challenge. And I know both professionally and personally people who are amazing humans who've had the illness, who were doing really interesting, complicated jobs before, but who then couldn't go back to work. And it was just physically impossible for them, and psychologically really challenging for them to be able to go back to work and go back to all the bits of their life from before. The other thing we learned about people in our journey over the last 18 months was that what people need to know to give help and to get help is actually quite complicated. It's quite complicated to be a patient and get help, but it's actually quite complicated to be professionals and work in a multidisciplinary way, know who's involved and who's doing what different people's roles are, and how we're going to work together to deliver the best possible personalized holistic support together. And a lot of the times we have conversations about how this is difficult because of IT systems, because we're not all on the same IT system, we're not having the same holistic planning conversations, we're not having little pieces of paper that move either electronically or physically from one part of the system to another part of the system. And this hindrance in the way we share or not share information is what we keep saying over and over again gets in the way of good quality joined up working. And we found that there's lots and lots of challenges around people knowing about what's there. So what services are in the community, what kind of services exist in the voluntary sector. So a hospital like Bart's, who are working with patients from, 5 or 7 different boroughs, how are they supposed to know what exists locally in each of the different boroughs in order to be able to really link people up with community organisations who are providing great holistic support? So that has been an enormous challenge for many people to date. And so we started to think about how we might help people increase their knowledge. And one of the consequences of our thinking is to organize today's training. So today's training is really about bringing people together from different organization structures and systems and tiers to come together to really think about cancer patients. But I think really we've used cancer as an example to hold this kind of a multidisciplinary training. What we're really trying to think about is integrated working in a joined up way, and we're using cancer as an example of how we might do this better. So we'll, as Tanya said, we'll have some resources available, and we'll have some information available later on that you can access. And some of the stuff you'll see in this slide around Macmillan Information and Support Service, some of the information we have about research that Macmillan have done around the different times of need and what people say we'll make available to you. I've touched on this already. Things are inconsistent and ad hoc at the moment. It's inconsistent how and when we give information, how we actually identify people's holistic needs, how we write it down, how people access support during the different parts of the pathway and where they are in their life and in their treatment, or whether they're just living at home. And care is personalized, but it isn't necessarily always personalized in the way patients want it to be personalized. So I think sometimes professionals have a very clear idea of how they're offering personalized care, but I don't think we necessarily always ask the patient what's important to you right now that you need us to help you with. That's a priority for you, because we are very, very focused on treating them medically and dealing with things we make assumptions about that they need. And so patients have told us that their experience of care is not seamless, and they think that there's a lack of coordination and there is not a smooth transfer of care between organizations and between services. That is not because you and I and all of us in the room and outside of this room are not interested in that, but I think working together in a very joined up way needs an awful lot of planning and thinking and willing, and some of the technological stuff that we suffer from that doesn't exist. Some of you who've heard me talk about this before will know that I'm a big fan of bits of paper when it comes to IT systems not talking to each other. And I think in the absence of situations where we don't have electronic systems that easily transfer information, we don't necessarily have formalized MDT meetings where all our patients who need an MDT type approach will be eligible for the MDT meetings that are happening in GP practices. We need to work in a different way with each other. Fundamentally, we need, for every patient who's got 4 or 5 people around them, we need to say, right, who's around this person? What am I going to do for this person? What do I need to let know the other people who are around this person? And therefore, how and when will I take consent to make sure it's okay to share this information and communicate and plan? And I mean that not just in a formalized MDT structure sort of way, but in a much more informal, there's a whole group of professionals, there's a team around the patient, how do we work together? So in identifying and supporting people's holistic needs, we needed to also think about how people are feeling, not just physically, but emotionally, what matters most to them, and what's most pressing for them in that moment that they need support with. Where are they in their cancer pathway? Are they at diagnosis, going through treatment, about to finish treatment, finished treatment last week and now sitting at home terribly depressed because the entire team that used to support them isn't there anymore, or whether they had cancer 2 years ago but life is still tough. Do they have other long-term conditions for which they may have more complicated lives and they need more additional support? Do they have a support network around them? Are there partners, family members, friends? Do they belong in community groups? Do they have carers and family members who need support themselves in order to be able to provide good support to their husband or wife or loved one? And do they have any other additional support needs? Do they need interpreters? Do they need advocacy? Do they have a learning disability? Are they housebound? So I think in order for us to provide really good holistic support that's personalized, we have to be thinking about these things right the way through. So this is just a slide that tells us a little bit about ways of working and the fact that in the absence of the perfect IT world, when we are encountering patients, we should ask them who else is involved, whether somebody's had a holistic conversation, do they have a copy of a care plan, have they been signposted and referred to other organizations. And I think for us to work in a very cohesive way, these are some of the key ingredients that we would need to think about and incorporate in our working life to provide the best possible care. I think it's important if we're involved around a patient that we understand how we feed back what we're doing and what's going on from our perspective as an organization back to the clinical team, back to the GP, back to the housing team or the social worker, whoever is involved. So the key messages for us to take home really as part of this training is having personalized and holistic conversations with cancer patients is probably mission critical, and to have them as early on as possible. Having conversations where we join up how we work because we're communicating well with each other, I think it's really important. And these things will really enable us to face the challenge of the fact that we need to know about what's going on, we need to be consistent in the way we practice what we want to do around personalized care, and we can actually proactively coordinate care around a patient.
Just a couple of things. So Alan and I have been in the back there trying to pull together on the CEPN website one link which will have the slide deck, today's slide deck, and by the end of next week the videos will all be edited. So there'll be part 1, part 2, part 3 should you wish to replay the videos, but you'll have the whole slide deck. So if you can all make sure, I think we've captured everyone's email address. If you have joined us and you may not have been on the registration list, please make sure you've got our email address and we'll email you out. The other thing, I'm just going to go back. The other thing that we're really keen on finding out is what you thought of today. So we've distributed, Margot and I, some evaluation sheets. You can leave without doing them, but I will probably come and chase you down. So,
and you don't want that.
It's really important. Honest feedback is how we've made this session better than the previous 2. But this is our last session. And the idea behind this is hopefully CEPN might want to use this, or Health Education England, or even wider, Waltham Forest, Newham, Hackney, Barkinghaven, Redbridge, or even South London might want to use this sort of model of working in an integrated way to provide better quality cancer conversations and support. On the slide deck that you get, you'll have my email address, as well as Becky's and Zereen's. The slide deck also shows you what resources are available. And now the thing about this is that we're very mindful of where we think something is running and then something changes. So where possible, we've provided you with links. As a go-to from walking away from today, this link, Macmillan's Resource for Patients, has pretty much one thing about every single thing we've discussed. So if you want to if you meet a patient later on this afternoon when you're seeing somebody who says, well, I don't know how to lose weight, you know, post my chemotherapy, I don't want to do too much, or I'm not quite sure what to do about my mum and her benefits as a carer to me, then there's a lot of information on Macmillan for that. There's also a free phone number for patients and professionals. So you as professionals could call that number if you wanted some guide as to how you could support the next patient you see.
And that's seven days a week, 8 a.m. to 8 p.m.
Yeah, and also that line has multiple languages. So patients who are not English as a first language can access support on that. There are clinicians in the room, but there might be people as well. This isn't just for GPs. It's a fantastic resource accessible to everybody at the Royal College. And it just talks about long-term consequences. What does that mean? And it's a really good toolkit, actually, that I'm sending around. Becky and the team have really helpfully pulled a starter for 10 on some local resources. The $1 million question for us all is about directories, who updates them, where do they sit. But what we didn't want you to do today was walk away, meet somebody, and then need to help them. A lot of people who work at the Trust will know about this. I know there's 2 or 3 in the room, but a lot of us in the community don't know. There's also an amazing centre at Barts called the Maggie Centre. There's also Macmillan posts all over the place. There's almost too much information, to be honest. Yeah, but at the same time, you know, if you want to think about a quick go-to, I've got this written down, and I just give a post-it note sometimes to patients saying, you know, Actually, I rang that to get some advice because I'm not an employment lawyer, surprise, surprise, about somebody who needed employment law advice, and I just went, I'm out, I have no idea about law. But I rang them and said, where would I send this patient to? Because they didn't feel empowered to ring that number themselves, so I helped them. So, I think
We have one more thing to
we've got
do.
one more thing. Well, there's two more things. One of them is a massive, massive thank you. Because I think coming out on a hot day, trying to keep alert with slides and heat and everything else, you've done a fantastic job. I also am really moved by the diversity in this room. And I think that's a really significant success of this programme, that there is such a massive mix of us. Okay, so if we can't make integrated care work with the commitment that's come into this room today, I'm not sure who can, and I know we will. We'll do it, right? I'm